900 women in Central Texas are expected to be diagnosed with breast cancer this year. And today, new information comes out about cancer statistics in Bastrop, Caldwell, Hays, Travis, and Williamson counties. News 8's Heidi Joe joins us live from Southwest Austin with more. Good morning.
Good morning, Todd. So some of these alarming statistics especially focuses on women that are from vulnerable groups like African American women. That group happens to have the lowest incident rate, which means they're diagnosed the least, yet they have the highest mortality rate. So this new study focuses on targeting those groups and coming up with an action plan on how to help them. And our guest this morning is leading some of those plans. We have Mary Moore Cavanaugh with Susan Komen for the Cure. It's good to have you.
Thank you. It's nice to be here.
Absolutely. So studying some of these groups, you talked about some cultural taboos or just some reasons why these women are specifically vulnerable. Can you go into those for us?
Well, there are cultures that have information that's been passed down from family member to family member, such as that cancer will kill you if you're diagnosed, that you don't want to know if you have cancer, that mammography causes cancer. And so one of the things that we're really focusing on is trying to replace some of this misinformation with factual information that would get women in for mammograms.
So getting into the early diagnosis is really key here.
Absolutely. Early diagnosis is the key to survival. And so it's about saving lives, and at the Austin affiliate of Susan G. Komen for the Cure, we are about reducing mortality rates, especially in groups with women that have maybe a higher incidence rate and or have issues with access to care.
And how do you get to that group, or how do you specifically get in there?
Well, it depends on the group. Obviously, having a survivor who can talk about her story and give women hope is a key component. But it's also about just finding key leaders in the community who want to help us get the message out.
Okay, well, good luck. Thank you very much, Mary. So we will be out here at El Buen Samaritano all day. There's going to be a mammogram van here that's going to give out free mammograms. Now, the appointments for today are already filled, but they are taking appointments for tomorrow, another free day. And we will also have more information about the study, which looks at 2 years of data from all our surrounding counties and gets straight to the point. Todd.
All right, thanks a lot. Heidi Joe live this morning. Again, those free mammogram screenings will be tomorrow at El Buen Samaritano Episcopal Mission. That's at 7000 Woodhue Drive.
Coming up next, a medical alert for women in the Austin area. KLBJ News Time is 7:07. More than 900 Austin area women are expected to be diagnosed with breast cancer this year, with more than 150 of them succumbing to the disease. The Austin affiliate of the Susan G. Komen for the Cure has a plan, though.
We target particular populations and that we increase awareness of everyone in our community. And that's the urgency here, is that through awareness, we can decrease these numbers.
Board President George Nolke says Hispanic and African American women are the most at risk. Today, the group will release its plan of action to address the 3 major breast cancer challenges in this region.
There are alarming new numbers this midday about women's health. A 2-year study of Central Texas women shows certain groups are more likely than others to lose the battle with breast cancer. KV Jessica Bass is live in South Austin, where one clinic is opening its doors for free screenings. Jessica.
Hi, Olga. This clinic is partnering with Seton's mobile breast cancer outreach program to try to curb the trend. We're now finding out about breast cancer. It was about an hour ago when we went inside this clinic's chapel to hear the results of a study that just released this morning. It shows that more than 900 women in our area will be diagnosed with breast cancer this year. The 2-year study compiled breast cancer data and survey information from women in Bastrop, Caldwell, Hays, Travis, and Williamson County. It shows that among the 900 women who are expected to face the battle over the next year, nearly 160 women will not survive. Free screenings like this one could help catch cancer early on and raise those survival rates. One breast cancer survivor we spoke with this morning says programs like this one helped her beat the battle.
I truly understand what our patients are going through, and I can offer my hand and my heart as other survivors go through the fear and confusion that comes with a positive diagnosis.
She now works with the program that is helping provide these free screenings. According to the study, the most at-risk women are African American, Hispanic, and women from low-income communities. Many have the higher risk because they don't get screenings. More than half of all African American women are not diagnosed until they reach a late stage in cancer, oftentimes because they just can't afford the health coverage. Well, those numbers are why these free breast cancer screenings are being offered. There are going to be more screenings provided tomorrow here at this clinic in South Austin. Now, all the funding for these screenings is coming from the Austin affiliate of the Susan G. Komen. And to sign up for the free screenings, you have to contact the organization, this clinic, to get your name on that list. You'll want to do so because there are a limited number of spaces available. Coming up a little later in the newscast, we're going to hear more from breast cancer survivors and when communities out here who are working on changing these trends hope to do so. Live in South Austin, Jessica Vest, KVUE News. Back to you all.
Well, there are some shocking numbers released today by the Susan G. Komen Foundation. They say in Central Texas alone, more than 900 women will be diagnosed with breast cancer this year. And of those, an estimated 159 may lose their battle with the disease. According to their research, African American women have the highest breast cancer mortality rate. And women who live in rural areas are also at risk, in part, they say, because of higher poverty rates and lower access to health care and insurance. The foundation says that the new stats are important to illustrate the prevalence of the disease.
It's important to understand that women in our community are being diagnosed daily with this disease. When they're not being diagnosed on the weekends, they're worried about the results coming in on Monday.
Well, the foundation also says it is very important for women to get screened to catch the cancer early. And experts say women over the age of 40 should get a mammogram every single year.
About half a dozen women are sitting in a waiting room at the El Buen Samaritano Episcopal Mission in South Austin. They are there to receive free mammograms provided by the Seton Cancer Care team.
The price of a mammogram is very, very expensive. So how much? If you just walk off the street and schedule yourself a mammogram, it's about $300, $325.
Dawn Parsons is a clinical manager for this mobile mammogram clinic. 5 days a week, they set up in churches and community centers around Central Texas, and they target low-income women who are uninsured or underinsured.
So the mobile program is unique in the fact that it goes to their community, in their clinic that they're familiar with, their neighborhood center, their church, and it gives them a level of comfort that they might not have, driving to University Medical Center at Brackenridge.
A new report says women from rural areas of Central Texas are more likely to be diagnosed with late-stage breast cancer, specifically women in Caldwell and Bastrop counties. It's usually because they're not diagnosed in time. For the same reason, African American women in the greater Austin area have the highest breast cancer mortality rate. Ramona Magid is with the Austin chapter of Susan G. Komen for the Cure, which prepared the report. She says Hispanic women also lag behind other groups in getting breast cancer screenings.
Almost a third of the Hispanic women contacted for our report admitted they had not had a mammogram in the last 2 years. All of these women were age 40 and over. Women in this age group are at higher risk and urged to get a mammogram every year.
Susan G. Komen for the Cure is using its report as a roadmap of sorts to identify gaps in breast cancer services around Central Texas. Komen Austin then gives money to organizations that are trying to fill those gaps, like Seton's mobile breast cancer screening. Most of that money is raised through the annual Race for the Cure. The next one of those is on Sunday, November 1st. Nathan Bernier, KUT News.
Y usted, mujer, no espere más para realizarse su mamografía. Los números recientes de diagnósticos en el área central son alarmantes. No tiene excusa, le decimos dónde hay lugares gratis para hacer el examen. Y atención, mujeres, un reporte publicado por la institución Susan Komen da cifras alarmantes en un balance sobre el cáncer al seno en nuestra área central. Este dice que se espera que más de 900 mujeres sean diagnosticadas con el mal este año. El estudio se realizó durante los 2 últimos años en los condados Bastrop, Caldwell, Hayes, Travis y Williamson. El reporte señala grupos étnicos en riesgo y cita varios retos para marzo del año 2011. Se anunció también que el Centro del Buen Samaritano y el Hospital Seton ofrecerán servicios de mamografías gratis. Esta representante de la Asociación de Cura contra el Cáncer, Komen, dice que a pesar de que las mujeres hispanas son diagnosticadas pocas veces que las anglosajonas, más mujeres mueren de la enfermedad porque son pocas las mujeres hispanas que se hacen una mamografía y otros exámenes del seno al año. Y para los servicios de mamografías gratis, contáctese para una cita con el buen samaritano.